The state's hospital network has been warned to brace for worse to come as coronavirus cases keep rising. Gladys Berejiklian says the number of people in COVID wards and ICU should peak in October. The prediction comes on yet another day of record infections. 4 more people with the disease have died, including an Indigenous man in Dubbo. 2/3 of the state's eligible population has had at least 1 dose of the vaccine. And the Premier says fully vaccinated people can expect greater freedoms come October. Here's state political reporter Ashley Raper.
In lockdown, a different kind of major event calls for a family outing.
First dose for all 3 of us, yep.
Pfizer has now become available to everyone over 16.
Check in on one of the Q codes.
I'm happy that I can get the vaccine now. It's such a good opportunity.
Randwick is the latest area to get priority access to Pfizer. But with limited supply of that vaccine, people outside the hotspots are being urged not to wait and get AstraZeneca.
Dr Chand and I and the Minister, we actually use the word joy when we see the vaccination rates go up, because that gives us heart that we are protecting more of our citizens.
Today, though, 4 more deaths were announced. An Aboriginal man died in Dubbo. He's the first death in a regional area in this outbreak. 2 people died at Westmead Hospital and an elderly man died after an outbreak at the Meredith House aged care facility in Strathfield.
As long as case numbers continue to go along, we are going to see tragically deaths.
And cases were up again. In the hotspots, 290 new cases were recorded in Canterbury Bankstown, followed by Cumberland and Blacktown. The cases are much lower in Bayside, Georges River, Strathfield and Burwood. Cases are now being monitored in Camden, Randwick, Ryde and the Inner West.
What really matters is what proportion of those cases are double dose vaccinated, what proportion of those cases won't end up in hospital.
Hospital numbers are increasing. Western Sydney paramedic Joe Ibrahim has spoken about his experience of treating a single mother.
Whilst doing so, her son made a comment to me, and that comment was, "I think this is my fault. I think I've given Mum COVID." That stopped me in my tracks.
Frontline workers have been warned things are likely to get worse.
We anticipate that the worst month, the worst time for our intensive care pressure will be in October.
The Premier wouldn't reveal how many people are expected to be in ICU at that time. She'd only say the health system is gearing up for it. But undoubtedly there'll be added pressure before then, based on the case numbers right now.
The health system is prepared, but will it be stretched? Absolutely.
But it's stretched now.
Well, it's stretched now, but there's capacity across the network.
And it's about to get tested. Ashley Raper, ABC News, Sydney.
Let's go now to Tim Swanston in Maryland. Tim, essential businesses in the hotspots have just 1 week left to make sure workers have had their first dose.
Yeah, that's right, Juanita. If you're an authorised worker who lives in a local government area of concern and needs to travel outside of your area, you have until this Monday to get at least 1 dose of COVID vaccine. Now, that deadline was meant to be today, but it was pushed back a week because of concern that some workers wouldn't be able to access the vaccine by today. Now, certainly that delay has taken some of the edge off businesses, but many large retailers have indicated that not all of their workforce who the rule applies to will actually be able to get a vaccine by this Monday. The Australian Retailers Association says it's highly unlikely that that will happen. So, for example, Woolworths, it still has about 25% of people that the rule applies to who still haven't received 1 dose of the vaccine. So it's no doubt that this Monday there'll likely be some pain caused to businesses because of the rule.
And Tim, the latest vaccination rates for each LGA have just been released.
Yeah, they sure have, Juanita, and they're already showing a discrepancy in those local government areas of concern between the highest and the lowest within their vaccination rates. So we've seen the Bayside LGA and the Liverpool LGA. They have some of the lowest first dose rates at about 63%, but that's not too far off that sort of statewide total of about 67% of a first dose rate. Whereas on the upper end of those local government areas of concern, Parramatta, a first dose rate of 72% or so, and Blacktown almost 74%. Now, we know that Blacktown is where a large amount of the new cases are, so health officials will really be hoping that that higher vaccination rate will translate soon to fewer hospitalisations.
Tim Swanston reporting there. The news in regional New South Wales is mixed. While case numbers in some areas are stabilising, infection rates in the west and far west are still high. And Dubbo has recorded the first regional death. Xanthi Gregory is live for us tonight in Dubbo. Xanthi, New South Wales Health says the man who died is the first Indigenous death in this outbreak.
Juanita, this is the news that health officials have feared since cases started to emerge in this region. The man who died at Dubbo Hospital is said to have had significant underlying health conditions, and his death has again shone a spotlight on the low vaccination rates among Aboriginal people who've been considered vulnerable since the start of the pandemic. After 3 weeks in lockdown, the Western New South Wales community is staring in the face of a tragedy.
Well, a very sad and sombre day today with the passing of a 50-year-old Aboriginal man in Dubbo Health Service.
He was among the thousands of Aboriginal people in the state's west yet to be vaccinated.
Our sincere sympathies and thoughts go out to the family, the friends and the broader Aboriginal community across Dubbo and the whole of the region.
2/3 of the region's cases are among the Aboriginal community.
Any death is tragic, and we're particularly concerned about the case numbers in far west and western New South Wales because of the overrepresentation of Aboriginal people.
The federal opposition says Aboriginal vaccination rates were allowed to stay low for too long.
I am laying it squarely at the feet of the federal government. They knew this was going to happen and did nothing to prevent it.
The man's death came on the day Western New South Wales recorded its highest daily total. At the same time, its lowest testing rates in weeks. There were 51 new cases in the state's west, 33 of them in Dubbo. The far west had 9, 7 in Wilcannia and 2 in Broken Hill. There were 6 new infections on the Central Coast, 5 in the Illawarra Shoalhaven and 3 in Hunter, New England. And the virus is still being detected in places without known COVID cases, this time at Trangie in the state's west and in Byron Bay on the far north coast. The tragedy has sent shockwaves through Aboriginal communities across Western New South Wales. The ABC has been told the man's family needs time to mourn his death. With Aboriginal people making up so many of the region's COVID cases, it's feared this death may not be the last. Xanthi Gregory, ABC News, Dubbo.